This segment of CoastLife is sponsored by Beebe Healthcare.
Well, CoastLife, I don't know about you, but when it comes to healthcare and navigating the system and deciding who your doctor should be, your primary care, your family care, it can be a lot. It can be a little overwhelming, and there are some things that maybe you didn't know that are common knowledge, or you didn't realize it was common knowledge, or it's not common knowledge and we just didn't know. And that's why we love our friends at Beebe Healthcare. We've got Dr. Ruffing joining us. And Doctor, you're with the new Long Neck location that opened up recently, which is very exciting. Last week we were talking about women's health care, and one of the things that maybe people don't realize is that a lot of times that family medicine does encompass pediatrics. So tell us a little bit about yourself and your role with Beebe.
Yeah, perfect. So my name's Ruffing. I'm double boarded in internal medicine and pediatrics.
Great.
And I'm a faculty member at the Long Neck location, supervising the family medicine resident doctors. So at that location, you're completely correct. We see everybody from newborns, pediatrics, adolescents, young adults, all the way to geriatrics.
Wow.
So I'm somebody that can help see those patients with the residents, and yeah.
I think that's especially comforting for people to hear that, you really could care for somebody from the time that they are born for the rest of their life when they need you, and you build that trust and you build that care, and it's like being seen by a friend or family member.
Yeah, that's what we like to do, is to see people as soon as they're born or as soon as they find us, and then we're happy to take care of them until they move or until they move on from the area. So we love having that continuity of care. That's one of our hallmarks of our practice.
Yeah, and it personalizes that care. It makes you feel like, again, that you're getting that personalized care that really can make a difference for a lot of patients. Mm-hmm. I also understand that you have some specialized training to deal with maybe some more complex neurodevelopment disorders. Tell us a little bit about what that even means.
Sure. So as a part of my residency in my last year, I did an embedded fellowship called LEND, which stands for Leadership Education in Neurodevelopmental Disabilities, which was a very cool program, and it was multidisciplinary, so it involved people, clinicians like myself, as well as physical and occupational therapists, and most importantly, family members and self-advocates. So it was a year-long program, and we did extra clinical training as well as research and collaborating together to learn how to best care for people with neurodevelopmental disabilities. Yeah. So I got a lot out of that program, and I really feel very comfortable taking on those patients in our patient panel and at our clinic.
So when it comes to pediatric care, maybe in a more general sense, what are some of the things that you guys look at, and what does that encompass with this Long Neck location?
Yeah, at our Long Neck location, we provide general pediatric care, so well child visits, anywhere from, like we said, newborn and up, and when that adolescent patient is ready to transition to adult care, we're here for that as well. Aside from well child visits, of course, we see people during the well child visits for vaccines or vaccine-only appointments. We also do sports physicals. Great. And then we have plenty of availability both for these well child and preventative care visits, but also a lot of availability for urgent care visits, coughs and colds and stomach aches and twisted ankles and things like that, especially during now cold and flu season. So we have plenty of availability for all of that.
Great. So just like Dr. Ruffing said, lots of availability, and if folks are looking for a new primary care doctor, or they just had a baby and they're looking for some pediatric care, and they're saying, you know what, Dr. Ruffing sounds like the right fit for me. Do you have availability and a way that people can get a hold of you?
Of course. So it's not just me at the practice. Of course, it's the family medicine resident doctors there first and foremost. So they are the primary care doctors. And we always say it's, kind of two doctors for one, because those resident doctors are right out of medical training. So they have all the fresh new ideas. And then they're supported by us, the board certified doctors, board certified pediatrician like myself, that are there to support them. And we discuss every case. We go into the rooms and we make sure that all of the care is being coordinated well. And like I said before, we have plenty of availability, both for preventive visits and for urgent care type visits. And our number is 302-645-3150.
Fantastic. So there you have it. Lots of ways to, make these guys your new family practice. I think it makes a lot of sense, especially if, you keep saying the young doctors, but you yourself are pretty youthful here. So you've got a good, I think a good team that'll be behind you for a long time. And I think that means a lot to our community. So thank you for being here today, and thank you for what you guys do.
Of course. Thank you so much. And please make an appointment with us.
Yes. So we'll give you some time to make that call, make that appointment. no better time than the present, right? But when we get back on CoastLife, if you are a home care provider for somebody in your life, you know that it can be a little stressful. We've got a team that may want to treat you, and we'll get into the details on the way.